Today's exercise snack is for hip and low back pain, the Somatic hip slides. Lie on your back, knees bent, feet flat. Flutter your eyelids closed if that's comfortable. Then take a moment to sense how your back and hips feel right in this moment. And just a quick reminder, Somatics isn't about stretching or forcing a muscle open. It's about waking up muscles your brain has quietly stopped listening to, something called sensory motor amnesia, or SMA. That's usually the real reason you feel tight. Now gently flatten your low back into the floor and maintain this gentle activation through the hip slides. We'll call this position neutral. Slide your right hip up toward your right armpit. Feel your waist muscles switch on. Now as slowly as you possibly can, let that go and allow your hip to slide back to neutral. Then rest in neutral. That slow release is called a pandiculation, and it's the release, not the squeeze, that actually retrains your nervous system. Do that 2 more times on the right. And then over to the left. Slide your left hip up toward your left armpit. Feel the waist muscles switch on. Now as slowly as you possibly can, let that go and allow your hip to slide back to neutral. Pause here. Then repeat that 2 more times, remembering to pause between each one. Then let's add a layer. Back to the right side, same hip slide. Slide your right hip up and at the same time reach your right hand down your leg towards your heel and let your head roll gently to the right. Pause and then release back to neutral as slowly as you possibly can. Do 2 more on that side, remembering to pause between each one, and then do 3 on the left. So one move and it can ease low back pain, sciatica, scoliosis, hip pain, and even a functional leg length difference. So give it a try, my friends, and then rest for a few moments. How does your back and hips feel now?